Hi, Dr. Yass here. In this video, I'm going to discuss an issue that I think is very confusing to people and makes it harder for them to understand what the cause of their pain is, and that is the fact that their pain is worst at night. This seems to be a very confusing issue for people because the average person assumes that if they're having pain from a tissue in distress, that tissue should elicit the pain at the time of the distress of the tissue, and that would generally make sense, except for the issue of muscle. And the reason that muscle's different is because, let's say that you strain your lower back muscles or you strain the muscles that support the knee, and you're having dysfunction, a difficulty in walking or bending or twisting or doing some type of functional activity. You would assume that you would get the worst type of pain at the time that you're having the difficulty in doing that activity, but that's not the way muscle works. And the reason is because when muscles are contracting, a byproduct of the contraction is lactic acid. Lactic acid creates this higher level of pH in the body. So what's happening is your muscles are contracting to do your activities. It's a byproduct of the contraction. You're getting lactic acid buildup. The lactic acid is making the pH of the blood become more acidic, and that's a problem for the body. It doesn't like that to happen. So what it does is it needs to draw blood into the area where the muscle's contracting to allow the lactic acid to be removed from the body so that the pH could be returned to a more normal level. So the thing about that's unique is that the blood is very, very warm. Blood is warm. So when you perfuse the area with blood, the muscle is maintained in a warm state. And as a result of that, it doesn't have the ability to shorten or go back to its strained state that it would if it had the opportunity to be in a more cooled situation. It's more normal temperature. So what happens is eventually at night when you stop doing activity and you're either sitting, say, in a recliner or you're laying in your bed, you're not doing activity. So now there's no need for blood to enter into the muscle because it's not developing a lactic acid and it's not decreasing basically the pH towards an acidic level. And therefore, you're not going to get that warming effect of the blood. So the muscle has a tendency, if it has strain, to kind of recoil to this shortened state. And since muscle has pain receptors along the length of the fiber, if the fiber is supposed to be this long and it has, let's say, 10 pain receptors, and now it's recoiled back to this length and it has 10 pain receptors, you've now concentrated the pain receptors, thereby causing it to elicit pain. So this is the reason why, whether you're talking about at night or whether you're talking about if you've sat for a sustained period of time, even if it is during the day, and then you try to move, you get pain. This is a very, very confusing issue for some people, and I think it's very, very important for people to recognize and understand this issue because it's going to help to guide them towards a better understanding of what tissue is in distress and thereby allow you to resolve the distress of that tissue so that it no longer has to elicit the distress signal of pain. I think that it is very confusing for people because when they're having the pain at night, again, they're trying to associate what is causing that pain at the time they're having the pain. And when it comes to muscle, you don't get that direct response of the eliciting of pain. It might happen if it's a severe type of situation. But for lots of people, if you're moving during the course of the day, your muscles are working, you're building lactic acid up, the body can't allow that to happen, so it's pumping blood in and it's trying to move that lactic acid actually to the liver to be converted and getting rid of it. So those muscles never have that chance to get back to their strained length, their shortened length, the length that happens when the muscle has the chance to cool off. And that's what happens at night, or again, if you're sitting for some sustained period of time. And what happens is the person gets confused and says, I don't understand. I'm doing nothing and yet I'm having pain. Why am I having pain? Or I'm sleeping at night. Why am I having pain? Well, now you have the understanding. That representation is not a representation of a herniated disc or stenosis or a pinched nerve or a torn meniscus or a torn labrum or a compression fracture. It is an indication of a muscular deficit responsible for your symptoms. So if you're having pain at night, or if you're having pain if you sit for a sustained period of time, now you have a rationale for why that pain is occurring, even though you don't seem to be doing anything. And I think that could become very scary for the average person. As long as there is not a sense of understanding, the fear of not knowing what's bringing on your symptoms is worse than the symptoms themselves. And that's where this idea of hopelessness, depression, all these negative emotions derive. It's not the actual pain itself that's leading to it. It's the fear of when it's going to come on, how intense it's going to be. It's the sense of unknowing. And what is the purpose of the Yass method? To spread the gospel of understanding, of knowing. So from now on, if you get this video and you're having pain at night, or if it's a sustained period of time when you rest and then you suddenly try to move again, now you know. The highest probability is that your pain is muscular. You're going to have to move toward the direction of getting a physical evaluation, which is at the core of the Yass method, to determine which muscles are responsible for eliciting the symptoms, and then understand how to perform the correct exercise using progressive resistance, which again is at the core of the Yass method. And you will be resolving the cause of the symptoms, not attempting to address the masking of the symptoms, which is pretty much everything that the medical system promotes at this point, because they've given up on the idea of actually being able to identify the cause of your symptoms, which is primarily because in more than 98% of cases, the cause is muscular. Muscular causes don't show up on MRIs or X-rays, nor is there any medical specialty educated or trained to identify them. I mean, this is just facts. This is just what it is. So that's why the Yass method sits outside the medical system. It is a more fitness-based promotion because of the fact that in 98% of cases or greater, the cause is muscular, which means you need a targeted strength training program. I've done this with thousands of people over 28 years. The results speak for themselves. I am sought from people around the world in different countries. The good news is that the method can be employed through Zoom or Skype sessions. If you would like to ask a question, if you're not sure, maybe this is starting to make sense to you, it sounds like it's something that relates to your situation, you can contact me by email at drmitch@mitchellyass.com, drmitch@mitchellyass.com. If you would like to make a Skype or Zoom session so that you can finally have your symptoms resolved, the cause of your symptoms resolved, and the good news is if it's muscular, then it's up to you to develop the appropriate strength. You begin to become in control of your situation. You get to control whether those symptoms are coming again or not. That's the beauty of it. If you want to make a Skype or Zoom session, again, contact me by email, drmitch@mitchellyass.com, drmitch@mitchellyass.com. If you like this video, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications when new videos are added or when I am live on YouTube. I hope this video is informative. I think it's going to awaken a lot of people, no pun intended, as to why their pain seems to be the worst at night, or if they're having the opportunity to sit and rest for long periods of time. It's actually a complete indication that the cause of your pain is muscular, which is exciting and important because now it allows you to take control. All right? For now, Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.